Dr. Sudip Bose, the professor at Texas Tech University Health Sciences, much more on this. Doctor, I don't know who has the edge in this quest for a virus or a treatment. I'm sorry, a vaccine or a treatment. But you increasingly hear from even the likes of Dr. Fauci that one could be in folks' hands by early next year, perhaps sooner. Do you agree with that?
Well, I hope so. And Neil, thank you for having me. I do hope so. I'm hopeful for this vaccine. I think it'll be a big part of the solution in combination with many of the other behaviors and things we're doing to keep the virus at bay. I don't think it's personally going to be a panacea. I don't think people are going to just line up and do it in the beginning, is just judging from human behavior and past behaviors with vaccines from patients I see. But I think like the steps that we're following are good, and the fact that we're doing it quickly means that we can do it without taking shortcuts. Instead of doing certain steps in series, we're doing them in parallel, and hopefully we speed up the process, keep the safety, and can get this virus behind us.
You know, a number of governors and municipalities are reimposing restrictions. We just mentioned what's happening in New Jersey, Doctor, where some gym owners are at a loss as to know why they're being fingered to stay closed or lose their licenses if they don't. And now we're hearing from Governor Murphy there's a need to go back to putting restrictions on. He didn't delineate exactly where, but he hinted at restaurants that need to open their walls to open indoors. In other words, to allow for that separation of people. But he's not the first governor to sort of reimpose restrictions. I'm wondering what you make of that, and that do we risk going through this every time we either open schools, resume sports, where you'll get an inevitable spike in cases regardless? What do you think?
That's a great question. And what I'd honestly like to do is find the best of both worlds. And often what the governors and the leaders are doing is they're basing this on mathematical models. And there are incredible mathematical models. I mean, genius level people working at this, and they collect the data and they basically make projections on a graph. And we've learned a lot from that. For instance, let's talk about seasonality. You look at the data with latitude from the equator. So if you're further from the equator, you're going to have more variability versus someone closer to the equator. And from that, you can project numbers about seasonality. So similarly, they're looking at data from if you make this law, that law, if you wear masks, and they're trying to make the best decisions possible. From what I'm seeing in the emergency room is that our testing has increased. We are able to test more people. And luckily, the people who come in and they end up intubated on a ventilator, we're able to decrease their mortality. In the beginning, it was like an 80% mortality if you're on a ventilator, if not more. And now it's in the 30s. But I would also say that what I'm seeing that's different than a typical flu season is our floors are filling up and our ICUs are filling up, and that's not something we typically see. So to answer your question, you know, we're looking at mathematical models, and this testing in and of itself, is that important? I don't think that's that important. I think it's our behavior from the testing, the actions we take from the testing, whether we contact trace or whether we follow the rules as individuals and try to make the best decision for our particular community.
Well put, Doctor. I always learn a lot. Dr. Bose, thank you again. Thank you for all your hard work on behalf of everybody, and even enduring idiotic anchors' questions, like my own.
Well, stay
very
safe,
good to have you, sir.
everyone.
Be well.